Hi everyone. So I wanted to talk to you today about heavy periods. I had a question from a mum really worried about her daughter, saying, what can I do to help my daughter with her really heavy periods? She's suffering so badly and I'd like some advice. I mean, what a lovely mum trying to find a solution to help a daughter suffering in front of your eyes. And as a mum, I know exactly how that feels. We'll do anything for our children. Now, I've been a fellow sufferer of heavy, painful periods, so I will try and help. And there are certainly some things out there that we can do. So first of all, heavy periods are debilitating, and not just in practical ways, but also physiologically. And what do I mean by that? Well, girls and women that have heavy periods really do often suffer in silence, but in so doing, they often avoid normal activity when they have their periods. So we quite often find that girls are missing sport, school days, university. They don't socialise, they suffer a stigma, but it's from their own fear of embarrassment should this period, which is so heavy, seep. And I know exactly how they feel. I've been there. On top of this, heavy periods can often cause an anemia. And to be anemic results in you feeling very tired all of the time. You can even be short of breath if it's very bad. And you just feel rotten, that you have no energy really to just approach the normal things of life. And the really frustrating thing about heavy, painful periods is most often there is no cause, or no cause can be found. And that can be really destroying because you want there to be a cause so that you can find a solution. But having said all of this, women with heavy periods mustn't suffer in silence. And I did, because really back then, I'm about 160 years old, we didn't talk about those kind of things. So I just thought it was normal and I carried on as best I could. But there are things that can be done, and it isn't just the contraceptive pill. I never got on with the contraceptive pill. Some women do, but some don't. So let's look at the other answers. Now, whilst it sounds scary, and I know there are lots of scary stories about it, the gold standard treatment for heavy periods is a Mirena coil. This is a coil with hormones, and for many women this just stops the periods completely, or it reduces them to almost nothing. So you haven't got that worry about the flow, you haven't got anemia, and you don't have to worry about being embarrassed. I have the Mirena now, and for me it was game changing. It also becomes really useful when you get to my age for HRT. After a couple of weeks of settling in when it wasn't so great, and a few months of spotting, I ended up after 6 months, so the spotting went on for 6 months, with no periods at all. It's reasonably easy to insert. It is a bit, but now they use a painkilling injection into the cervix to pop it in. It's very tiny. It's easier for women who have had a baby, but that doesn't mean that women who haven't had children or younger women are ruled out. They can still have one. And if they're really worried about it, or the person doing it thinks it might be tricky, you can get a referral to gynecology, where it can be done under sedation to just make it that much easier. And as it can be left in place for 5 years, that's kind of justified. Now, it's very easy to remove. I mean, they can be removed in a GP surgery. Fertility is restored immediately, and I know from my patients that that's often something that they worry about. But with this particular one, you don't have to worry at all. And I know that because the last time I had mine taken out, I then had my lovely little girl. If the Mirena isn't quite for you, or you're worried about it, there are other places you can start which are not quite so invasive. There is a tablet called tranexamic acid. Now, this can reduce the blood flow by half. And if you combine that with another tablet called mefenamic acid, you might only need one, but at least you have options here by adding another one. The two can work together, so synergistically, and they can help reduce blood flow by a further quarter. So these two tablets together, or even separately, can really help. And your GP can help with it. Don't be shy. Go forward. We know about this and we see it as a problem, but they are prescription medications, so you will need to go to your GP. Now, after these options, you are then looking at contraceptive pills. So either the combined contraceptive pill or the progesterone only. both of which can really reduce flow and pain. There are many suggestions for natural therapies, and I am a great one, as you probably know by now, but looking at natural ones, which you might want to try first. I can't vouch for any of them because evidence is always hard to come by. But the ones that come up the most often are vitamin C. This vitamin may help reduce bleeding. It might also help your body absorb iron, which is really important, obviously, if you've been bleeding heavily, because it may help prevent iron deficiency. Then there's iron. Now, this is really interesting and it sounds paradoxical, but there is some evidence that suggests that if you're low in iron, this might actually contribute to heavy periods. So if eating an iron-rich diet hasn't improved your levels, and it is important with iron to check your levels, supplementation might help. Now, I would always do this via a doctor because too much iron can be bad. So don't just assume, have your levels done. It's a simple blood test. And then magnesium. Magnesium is one of those vitamins that comes up all the time. It helps with bowels, it helps with sleep, and it helps balance hormones. So foods such as seeds, nuts, green vegetables, leafy vegetables, fruits like avocado and banana, legumes, so peas and beans, seafood, tuna and salmon, are rich in magnesium. So you should be able to get enough from your diet, but you could always supplement. Certainly for my menopausal women, I always suggest they supplement. But please do ask your doctor and get checked for an underlying cause, because I said that mostly there's no cause, but there are some things that do cause heavy periods. So being hypothyroid, your thyroid not working well enough, can cause heavy and more frequent periods. Polycystic ovarian syndrome, endometriosis, infection, anemia. It's important that all of those things are ruled out. So please go and see your GP, tell them you want all of those tests, get your iron checked at the same time, and then find a treatment that might help with you, for you. So I hope that really helps. As ever, thank you for watching. If you've got a comment that you want to make, just pop it underneath. If you want us to actually cover a story for you, a medical thing, if you want to ask me any questions, just do so in the comments. And thank you so much for your support. Take care.